town hall about kids, care, and COVID-19, reopening childcare centers and schools. We are going to be muting you if you happen to turn off your microphone, but we want you to have the capacity to use that later on. We are encouraging everybody to introduce yourself in the chat box if you'd like to give people a sense of who you are and where you're coming from. So here at First Policy Response, our goal is to bring the Canadian policy community together to highlight the best economic and social policy ideas to keep us afloat and together. Our focus is on those ideas that can get Canadians through the immediate crisis and prepare us for a sustainable and equitable recovery. We are aiming to engage the entire policy community, including frontline leaders, policymakers, and those in the private sector, labor, academia, and the not-for-profit sector. We're especially keen to add voices and organizations that bring further diversity to our group in this work, and we're going to do our best to amplify those voices. So before I begin, I want to give the land acknowledgement. We do this as a symbolic restorative act, one among many to follow, and part of a wider and hopefully transformative reconciliation project here at Ryerson. Ryerson is on the territory of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat. It's covered by the Dish with One Spoon Treaty, Treaty 13, and the Williams Treaty. We are committed to honoring our obligations to these nations, treaties, and to justice for Indigenous peoples generally. In this project, we hope to do that by amplifying Indigenous voices, including through the publication of contributions and building and strengthening partnerships with Indigenous organizations and communities. Most recently, we've launched a contributors fund to support pieces written by underrepresented groups with an emphasis on Indigenous and Black writers. So for today's event, we're going to have about 30 minutes of moderated discussion with our panelists, and then we're going to start taking questions from you. We're going to use Slido to do that. So to ask a question or to vote for other people's questions, you can go to Slido, so sli.do, and enter the code FPR6. So we're going to put that information in the chat box as well a few times. So sli.do, and the code is FPR6. And there you can ask questions and also vote for other people's questions. And then after after the moderated Q&A, we're going to have an opportunity to have smaller breakout discussions where you'll each be in a room with one of the panelists and can discuss and ask questions in a more intimate setting. Please note, as the robot told us earlier, this session is being recorded and will be posted on our Twitter page at Policy Response and our newsletter in the next few days. We're also very happy to have Farah Nasser to moderate this discussion. Farah is an award-winning journalist bringing extensive experience to her role as the anchor on Global News at 536. Her status as a trusted journalist with a strong political background has earned her the opportunity to moderate key political debates, including the Maine 2018 Ontario provincial election debate and the only broadcast 2018 Toronto mayoral debate. And most importantly for today's discussion, she's a graduate of Ryerson University's Radio and Television Arts program, as well as the mother of 2 young kids. Thank you so much for being here, Farah, and I will pass it over to you to introduce the panel and kick us off.
Thank you, Sam, and I'm so happy to be part of this important conversation. It's something in terms of news that's really important right now, but also being a mom, as you mentioned, something that is on my mind every single day. So I'm really looking forward to hearing our experts weigh in on this. And we also have some policymakers, some very important people from government, civil society, who are with us as well today. So hopefully this will shape the conversation going forward. Without further ado, let me introduce you to our esteemed panel today. I'm going to start with Elaine Levy. She is the Vice President, Childcare and Family Services with Woodgreen Community Services. She became the Director of Child Care Services in August of 1982, taking Woodgreen from 2 child care sites to 7, as well as special needs resources, summer camps, and after-school programs. Elaine led Woodgreen's role in developing and operating the Bruce Woodgreen Early Learning Centre, a Toronto First Duty site that integrates kindergarten, childcare, and parenting support into one comprehensive program. And it was this program that contributed significantly to a 2009 report to the government on a full-day kindergarten and served really as a model for early years learning. She holds a PhD from OISE, the University of Toronto, in early learning, and she is with us today. And she's also a registered early childhood educator. Our next panelist is Monica Lysak. She is a professor for early childhood leadership for the School of Education at Sheraton College. Monica is a professor at Sheraton College, as I mentioned. She's also a former special advisor to the Ontario Minister responsible for early years and childcare and the status of women. She worked for the Saskatchewan government on its federal and provincial early childhood working group, which negotiated the terms for the National Multilateral Framework Agreement for Early Learning and Childcare, and that was in 2003. We also have with us Carol Campbell. She is the Associate Professor for the Ontario Institute for Studies in Education at the University of Toronto. She is a member of the International Council of Education Advisors for the First Minister and Deputy Minister of the Scottish Government. She's originally from Scotland. Dr. Campbell has held education, academic, and government roles all over Canada, the UK, the US, and in Canada, the UK, and the US. She's done a lot of policy work in this space. She's previously held progressively senior government official roles with the Ontario Ministry for Education. She also became the first Chief Research Officer and was appointed as an education advisor to the Premier and Minister of Education here in Ontario from 2014 to 2018. We also have a student perspective on this panel today. Simon Harris, he is the policy coordinator for the Ontario Student Trustees Association. He has worked to gather and amplify student voices and feedback about issues that matter most to students. His recent work has been looking into the feasibility of a proposed mandatory e-learning requirement for Ontario high school students, preliminary surveying of equity among marginalized students across the province, and a set of recommendations based on the transition back to class from a distance learning environment. Simon, I really look forward to your perspective here on those specific points. Simon is set to begin his bachelor's in public affairs and policy management with a specialization in social policy at Carleton University, and he will be starting that this September. So without going any further, I just want to get right to these questions because there's a lot to talk about in the time that we have. And I think we should begin with two reports that have come out, and I know many of you who are in this space have watched these, have looked at these reports very closely. One is the Sick Kids report. It came out last week, and it suggested that public health harms of keeping children at home outweighed the risks of them going back to school. Then we also have the Ontario government report that announced 3 scenarios for school boards to prepare schools for in September. So I'm going to start with you, Carol, and then go to Simon. And I want to understand your reactions to these 2 specific reports. Carol.
Thanks, Farah, and thank you for the invitation to be part of this panel today. I'm delighted to be part of the conversation on what is the last day of the school year for most schools and most students in Ontario. So congratulations to Simon and the fantastic work that students and student trustees have done in what's been a challenging year, especially over the past 3 months. So thank you to educators, students, and of course parents and everybody who's really pulled together. And that's one of my messages. You know, whatever next year brings, everyone's going to pull together to do their very best. We know, unfortunately, it's not going to be a status quo year. There is no scenario in which that's likely. And so you've pointed, Farah, to 2 sort of high-profile reports. The Sick Kids report. So I'm not a medical expert. I'm a professor of education. So part of me will let the medical people argue about the details of the Sick Kids report. I think from a policy perspective, we've had over 3 months where there's been a real coherence between what the Canada's Chief Medical Officer, Ontario's Chief Medical Officer, and for us in Toronto, Toronto's Chief Medical Officer have said. So we're socialized into 2 meters, you know, wear a mask if you choose to wear a mask, all sorts of things. And Sick Kids agreed with some of that, but they varied from some of that. And some very reputable medical experts have been critical of the report. So as an educator, there's some confusion about, well, what's the real deal here? So my hope is that there will be clear public health messaging as applies to schools as well as to wider society, and whatever we do adheres to that public health messaging. From an education perspective, So, you know, we're not on our own in this journey. Over 195 countries fully closed their schools. What we are seeing is that about over 70 countries have started to move forward, as well as some provinces here in Canada. And unfortunately, not in every case, but in most cases where schools reopen, clusters and outbreaks of COVID have happened concerning students and staff. And then they leave school and there's a spread. So I do have concerns about the physical health element. And I think we have to be really careful about that piece. Some education systems are in the unenviable task of reclosing schools now, if we look at Beijing or Israel or France. So that needs to be clarified. There's no doubt that mental health is a serious concern, and that needs attention too. Surveys are now coming forward from Toronto, and COVID has affected people differently, and the school closures have affected people differently. So there's actually some students who are happier at home. They're calmer, they are happier, they like being at home. But there are some students who are bored, anxious, and at the worst extreme, there's abuse and there's real concern. So we have to balance out the mental health. I just hope that we do that in a holistic way. So school reopening is not the solution to children's mental health, it's part of the picture. Which I guess brings me to the scenarios here in Ontario. So on Friday, the government announced 3 scenarios. As near to possible as normal school reopening, but with public health measures. A blended approach, so students in cohorts of 15 within a class, so some students in a class, some students at home, blended learning, or continuing remote learning. So these 3 scenarios are, to me, are sensible, they're reasonable, they're the correct type of scenarios. Because what we see when we look around the world, it's these scenarios that are happening. So I guess what I would say is they're kind of obvious. And because of that, school boards have been planning on this type of scenario, and I'm reassured by that. I guess my concern is it took to the end of June for these to be announced as the plan for Ontario. You know, you mentioned my international work. I've been working with other education systems for 2 months on this type of plan. So I wish we were further ahead, although I know there's been a lot of work in the background, because at the end of June, it's effectively, here's scenarios, 72 school boards figure out a plan by August. And I'm confident they will, but I think we could have been a bit further down the line with the planning on that. I guess my other concern is that the funding announcement came out on the same day as the scenarios for education. And the funding announcement is simply not adequate to meet these 3 scenarios. It's very much based on the government's existing modernising education plan. So yes, there's some areas of investment, but I do worry now that the Minister has said the sort of preferred scenario is the blended learning, the 15 students in a cohort, that the funding levels are for 20 to 24 students in a classroom, but we're going to have 15 students in a classroom. That has staffing implications. Remote learning will be continuing. We don't have universal broadband. We don't have one-to-one devices for every student or every educator. We don't have schools that are structured around single desks in isolation and all of these pieces. So I worry about those pieces. So overall, I think the scenarios are the right scenarios. I think there's a lot of details to be worked out. I wish they had been announced a bit sooner so that we weren't in this situation coming into the summer holidays. But I am confident that everyone will pull together to make this happen.
I like your sense of hope there. And yeah, I think you make a good point in terms of these scenarios. I think many of us thought that when they came out, that these options were very obvious, that we knew kind of that was going to be one of these 3 options. I just want to remind everybody to please mute their microphones in case they haven't already. I believe we're muting your microphones, but just in case, make sure your microphone is muted. Simon, I'm going to turn this over to you from the kids' perspective. And, you know, it's interesting just picking up what Carol said. I mean, I have 2 kids. kids and very different points of view. One could stay at home forever, and one just needs to get back to school and needs to have that socialization as soon as possible. So talk to me about that, the Sick Kids report, your thoughts on that, as well as the Ontario government report and these three scenarios.
Thank you, Farah. I am absolutely delighted to be spending my last day of school. And my last day of school within Ontario's public education system, here with you all discussing some policy perspectives. I will note really quickly, I can be a little bit difficult when it comes to spontaneous words, so I do have some things written down. I'm no medical expert, just like Carol, right? I'm not too sure exactly, I can't speak on behalf of medical experts when it comes to epidemiology. I'm no safety expert either. But what I am is a student who actively participates in the system. I go to school 5 days a week. I'm in school 10 months out of the year. And I know that if anything is going to come first, it's going to be safety. I spend my time within the walls of a school with 1,100 other students, 100 staff. And as much as it's important to focus on going back to school, it's difficult to be in a learning scenario that actively supports every student without guaranteeing their safety. You can't build towards self-actualization without guaranteeing safety protocols. The Sick Kids report that you mentioned, which is a very crucial report, Farah, stated that there was some mounting evidence about transmission, and that kids don't transmit COVID-19 at the same rate as adults. The concern with that publication, and there's quite a few, and I won't speak on behalf of the full implementation, but I have serious concern that we would be putting students in danger with some of these recommendations. The Sick Kids report asked parents to self-test and to be able to self-diagnose. That doesn't adequately cover a lot of it. No, Public Health Ontario has said children and teenagers are more likely to be asymptomatic. Sometimes it's not enough to do a self-assessment. How are we enforcing screening? Would teachers' federations and other administrative staff and other non-union staff be willing to sign on to this? Schools can't be closed forever. I think everyone knows that. We're going to have to transition back eventually. But what solutions can we actually deliver that can be monitored, right? And I think we're gonna go into this. But a lot of the recommendations that were listed within that Sick Kids report aren't simply as monitorable, right? We're forcing ourselves to be in a scenario by coming up with these plans for September, October, November, December, where we're gonna have a limit on gatherings, right? Right now it's currently 10 people. We're essentially trying to force a gathering limit to be projected for September, October, November, December of hundreds of students, right? We don't know what it's going to look like going into the future, right? We're not sure if there is going to be a second wave, if we are going to have to reclose schools in the fall. I'm a little nervous that we're planning too far in advance and that we're planning in a very centralized manner, right? I'm in Sarnia, so I'm about 3.5 hours away from Toronto. The situation for COVID-19 here is much different in Lambton Kent schools as it is from Toronto District School Board schools. Developing a very centralized model may not work, may not be reflective of individual school board needs, of density concerns. Those need to be taken into consideration as well. So kind of going into the three recommendations from the ministry, I appreciate the sense of adaptive curriculum delivery. we're not sure what this is going to look like going into the fall. We're essentially preparing for a scenario that we can't imagine yet, right? In late February, we did not know that schools were going to be closed until the remainder of the year, right? We did not understand exactly what the implications were going to be. So in order to move forward, as suggested, we have to come in with an open mind. We have to be willing to explore all possible avenues, and if those three are the best way to do it, then so be it. There are some gaps within that report I will mention. The ministry did announce cancellation of EQAO. They announced cancellation of some elementary testing. That plan, however, does have some gaps for secondary students. We're still expected to take the OSSLT. We're still expected to do community involvement work. Those little discrepancies need to be addressed. What are these refresher resources going to look like, right? At least within Ontario, are they going to be centralized in the same way that the Learn at Home platform was delivered, or are they going to be more localized and locally developed? These are the questions that we need to be answering before we can really move on into the future, right? And I think Carol brought up an excellent point with the funding announcement, right? We're really focused on, or the government's really focused on putting in forward their mandate, and their mandate that they've set out since, well, what's coming up to be a year and a half ago. But does that $25 million do enough, right? There was $25 million announced in technology and mental health, and they're allowing boards to go back into their funding allocations for 2019-2020 school year. But we're not sure what the shape of this disease is going to play out to be in the fall. So will that amount of money do enough?
Okay, these are very good points. What I'm hearing from you, Simon, and I'm just want a brief answer on this question from you, is safety. You mentioned safety is such a top priority for you, being a student. What is the top thing that we need to get right in terms of school safety come September?
I feel like it's hard to boil down to one thing.
Okay.
If it's to come down to understanding the student and being able to understand the student environment, we need to have empathy for students. This is a very traumatic time. This is a once in a century style pandemic, right? We're used to being kind of mandating systems across the board and being harsh when times call for it. But considering that this is a public health emergency, we've spent so much time distanced, and there's a collective trauma that comes from COVID-19. We all need to be generous to students. We need to be able to empathize with their situation and guarantee them the flexibility that they deserve, and special considerations to students from equity-seeking and marginalized backgrounds.
That's a good point. I'm glad you ended on that point. Carol, I'm going to turn it over to you. You have, as you mentioned, I mean, you have knowledge of other countries. Is there one thing, and after this question, we're going to move to childcare specifically. So is there something that you've learned from another area in terms of safety come September?
Yeah, I mean, this is extraordinarily complex, which I think is why Simon and I are trying to be respectful to the panel, but it's difficult to give short answers. I mean, we have the three scenarios, and I've said that I think they're actually realistic. My preference would have been that they were stages, in the same way as we see the stages for reopening Ontario. So in Scotland, where I'm an advisor, there are stages connected to what will happen with schools, with principals, data points about COVID numbers, rates, spread, and what the decision-making process will be. And I think for everyone, that takes away, well, which of these scenarios is it going to be? You can see, well, COVID is still high in Sarnia or in Toronto, so we're probably going to have remote learning. So I like the idea of stages where there's clear data and decision points. I just think it's transparent for parents and students and everyone. The physical health is absolutely paramount. You know, unfortunately, everything from transport to entry and exit to schools, to corridors, to washrooms, to classrooms, our schools are not set up this way. And while the Ontario announcement recognised some of these challenges, they are largely leaving school boards to figure this out. So that concerns me. You know, and I think to Simon's point that there's a recent study of students in Toronto by Maximum City, and while 61% are missing school, 79% are more concerned about getting COVID or somebody that they know getting COVID. So we have to deal with the emotional, the empathy, all of these places. A lot of parents are not sending their children back to school at the moment. So there's the factual side of safety, but there's the emotional side of safety. And I know I say investment, and I know that's a challenging one, but this is everything from deep cleaning to teaching at home, at school, blended, educational support, assistance. The emerging evidence is clear that the children that are poverty, disadvantaged, English language learners, special education, single parent households, which takes us to the childcare, are the people that are most disadvantaged at the moment. So we do have to look at this holistically. And we also, I'm an educator, we have to ensure quality teaching and learning. We need to make sure that in all of this debate, we don't lose the fact that, as Simon says, you know, if EQAO is not happening for 2 years, let's take that and reinvest into diagnostic assessments, formative support, feedback to parents, things that will really support students to progress and learn.
Thank you for that, Carol, and you as well, Simon. I can't imagine what it's like to be a student right now, and I really appreciate your perspective on this panel. I want to turn it over or change the topic a little bit, just talk about childcare specifically. Now, the government announced the reopening of childcare centres. It's been 2 weeks. So I'm going to go to Elaine and then Monica on this. Elaine, how has the childcare sector been reacting, I guess, to this, and what have been the barriers to reopening for some?
Thanks, Farah, and thanks also for the invitation to be part of this panel. Well, we were certainly surprised by the announcement, as were all of our partners at the municipal level, the school board level, especially because a few days before that announcement, we had received an announcement that childcares would continue to be closed until at least the middle of June. And then we heard that, in fact, they were ready to open, could open within 3 days, which was pretty short runway. We didn't immediately receive the provincial operating guidelines, and when we did receive them, they're extremely detailed, which of course they need to be to to ensure some of the things that both Simon and Carol have talked about in terms of health and safety, and that measures were in place to really safeguard and promote and protect health and safety of the children, of the staff, of families. So one of the key requirements within those guidelines, similar to what they're looking at with schools, is the cohort model idea. And the cohorts that they've set for childcare is a maximum of 10 individuals in a room, which would include children and staff. And that cohort has to remain intact throughout not just a day, but a week. And there can be no intermingling of cohorts from one to the next, and they have to really be a distinct group. And that's all in the interest of promoting and trying to limit physical distancing and promote environments being as safe as they possibly can be. So on the one hand, that's a sound approach to trying to restrict group size and stay within that. But of course, one of the big restrictions that we face is that if you take, for example, a school age room that used to be licensed for 30 children, and all of a sudden you have a maximum of perhaps 8 children with 2 staff in order to cover off the day. Certainly with childcare being a fee-for-service, enterprise from that perspective, the funding pieces are enormous. And so that's one of the huge barriers that the childcare sectors are facing. So in addition to the staffing that's needed to be able to work within that cohort model, we need to have a screener. Children have to be screened before they come into the center using a fairly detailed checklist and including a temperature check. Parents are not allowed in the centers, so there has to be somebody who screens and somebody that's in a role that's called a runner who will take the child from the screening area to their room. So all of these are very human resource intensive. And again, I think that they're good practices in terms of promoting health and safety, but they also require that we have enhanced staffing models in place. And there's also a lot of regulatory pieces around cleaning, disinfecting, having protocols in place in case a child or a staff member does become ill, disinfecting, monitoring all of this, keeping detailed records on who's in attendance, all of these processes that have happened. So, I mean, we're used to being heavily regulated. Childcare is a heavily regulated delivery system. And then within the city of Toronto, for those of us here, in addition to the provincial regulations, we also partner with Toronto Children's Services, and there's more regulations through there, and then also public health. So I think one of the things that's been very positive is that we've received a great deal of support from Children's Services, from public health in helping to create different policy frameworks. A lot of really good training that's been developed that's available, and trying to ensure that people really understand both what's in place and then how to communicate that to parents, because as several people have already mentioned, parents aren't necessarily comfortable having their children come back. So they need to be assured that the environments are safe and that good systems are in place for their children and also for the staff. I mean, I think that they care a lot about what the experiences are for the staff that are working in the programs. But really one of the hugest barriers, and it's not unlike what both Carol and Simon were already talking about, the funding piece is so critical. Especially, and I think one of the things that sets the childcare sector differently, positions it differently from the school sector, is that we're not publicly funded. And we do rely on fee-for-service. So even though we're part of the Ministry of Education and part of that, fall within that umbrella, the way that we're funded is very different. And that's always been a challenge. It continues to be a challenge. And as we look at all of these increased expenses for staffing, for PPEs, for cleaning, for all of the safety measures that we have to put in place, if the funding model isn't seriously addressed, there's no way we can expect parents to cover those fees. Childcare fees in Toronto are already the highest in the country, and parents just can't meet those costs. And it's not only sole support parents who rely on our services. Childcare is an integral piece of the whole economic functioning of our system. Families need to, and more families are getting called back to work. So that is a real challenge. We really want to get back to serving our families. We look forward to welcoming back the children and the staff. And we also really are looking forward to trying to elevate the conversation beyond all of these regulatory pieces to really be able to focus on the pedagogy, which is really the heart of early learning. I mean, this is children's first experience often in the education system. And yes, we're all about making sure that we ensure health and safety, but it's the pedagogy that we really want to be able to focus on as we do welcome them back.
Okay. I'm going to bring Elaine in this conversation. And Elaine, I mean, there's policymakers who are listening to us right now. So what solutions can policymakers advance to close, learning gaps? And what concretely do you want to see from levels of government to support the childcare sector through this crisis?
I'm sorry, did you wanted me to answer that as well?
Oh, sorry, I'm gonna get first Monica. Sorry, my apologies, Elaine. I'm gonna get Monica to answer this since we haven't heard from Monica yet.
Thank you, Farah. I really appreciate it. I really appreciate the opportunity and invitation to be here to speak as well, and just wanted to acknowledge that I am a Treaty 4 person originally from the Treaty 4 lands in Saskatchewan. So just in terms of going back to the reaction, I just wanted to say that the childcare sector, I think, went from surprise to frustration that the government, ignored their very comprehensive recommendations. And now there's a level of vitriol in the childcare sector that I've never seen or experienced before. The Association of Early Childhood Educators, the AECEO, and I see Vera and Alana here, and the Ontario Coalition for Better Childcare, surveyed the sector well in advance, did a lot of planning, put together a really comprehensive evidence-based plan, recommendations, put it forward to the government. It was completely ignored. So the Ford government then, sort of had this let them eat cake response and just put out, surprised them, sprung this on them. And then on top of that, there are punitive fines that were announced, where if educators don't follow the guidelines, they can be fined $1,000 for non-compliance. So I think the sector is really feeling like a punching bag right now, and so there's a lot that needs to be done here, because it's certainly families and children that are paying the price for this. Lots of centers have closed, and some may reopen, but they can't. I mean, they just can't. So what's different here in this? When we talk about the solutions here, when we talk about the 3 scenarios for going back to school, 2/3 of those scenarios actually assume childcare as a partner, and we have part of this equation is missing. So as Elaine said, childcare is not a system. It's not publicly funded. It's not publicly managed. If we look to Quebec, we can see where they were much more nimble in being able to respond because they are publicly managed. They are publicly funded. So here in Ontario, we have this very fragile system that people perhaps weren't aware of until this pandemic happened. And now the issues that childcare is facing could really cripple the economy in a sense. So I just wanted to share, you were asking for about the recommendations, and so I wanted to acknowledge, first of all, my colleagues and I who put out a report. Andrew Bevan, who's the executive advisor to Mohamed Faki, chair of the Faki Foundation and former chief of staff and principal secretary to Premier Wynne. Kate Bazanson, associate professor of sociology and associate dean of social sciences at Brock University. And Kate Hammer, former Globe and Mail journalist, former education advisor to the Premier, and now with Van City in Vancouver. So we put together a report, some recommendations, looking at what should happen, what needs to happen for childcare. So the first thing is, the Prime Minister introduced $14 billion for the provinces. And childcare was named as one of those priorities. So we're calling for a minimum of $2 billion of that $14 billion to be invested into really 5 things. So the first thing is, as my colleagues on the panel here have already brought our attention to, we have reduced capacity in schools. Schools not only provide education for children, but they also provide the role of childcare, as evidenced by governments providing funding for childcare to parents during strikes or the pandemic. So there is a recognition that schools also provide that role of childcare. So we are now going to have probably at least half of the children, school-age children, up to the age of 10 or 12, who will now need somewhere to go. So we started off with a really fragile childcare patchwork, and now we've put all this increased pressure, and we have to have places for children to go. So the first thing that we need to do is, or the provincial governments need to do with that federal money, is to commit to restoring the pre-COVID number of spaces. So let's just get us back to the starting point. How many spaces have we lost? How can we shore that up? So in order to restore that capacity, we can create some spaces in perhaps some satellite locations. And this is going to be a challenge. There are areas in Toronto where, you know, we couldn't fit another person in some of those densely populated areas. You know, we couldn't fit another person in with a shoehorn. So where are we going to put childcare? So there are some challenges, but building that satellite permanent spaces. So as we roll back eventually to normal times and better ratios, more children in those spaces, we will have increased capacity in a permanent way. And then really looking at what we need to do. Here we are, last day of school, it's summer holidays. Parents who are going back to work really need opportunities for their school-age children. They need care, and they also need that stimulation that we were talking about. So investing in school programs in July and August for programming for school-age regulated childcare and day camps. And then building on that to transition back to school in September. How do we transition back? So creating a plan, a concrete plan to expand those childcare spaces to accommodate the children. And part of how we do that has to be, I think, calling on the federal government to meet their commitment that they announced in the last federal election to establish a secretariat. We can see that the childcare policy is very complicated. And so we need a secretariat to coordinate, to work with the provinces through the federal government to help make sure that these things happen. And the other thing that I would add to that is that there are no shortcuts. You know, Canada is finally at this time where we've reached a point where we can all see that what we've been doing for childcare up until now hasn't been working. What we're proposing isn't a novel idea. In fact, the OECD countries are already doing this. We can look around the world and we know that Canada ranks last in terms of our investment in childcare and in terms of our structure and how we support families. So we can catch up to some other countries in the world. We can look at those OECD countries and what they're doing and learn from that. And move this forward in a way that is lasting. I'll just close these comments by saying, sometimes for any officials that are listening, you know, it's a little bit like my college students. Sometimes they want to take the shortcuts, right? There are no shortcuts. You have to do the right thing. You have to do the hard work. And so that means, you know, these ideas of, you know, portable benefits where there are coupons for services that don't exist or a little bit of money towards a problem. You can't buy what doesn't exist. So there are no shortcuts. We have to, eventually we are going to have to build a childcare system to support, you know, the children and to support their parents.
It's interesting. I mean, things that have been so fragile going into this crisis have just been so exacerbated. This is an example. Long-term care is another example. I have many more questions for you, but our audience has a lot of questions as well, and I want to get right to those. And the number one question right now, and Monica, I don't know if you want to answer it first, Elaine, Carol, or Simon, but the top question right now is, how can we better help students with special and complex needs? So would you like to start with that, Monica, or do you want me to turn it over to Elaine?
Sure, I'll just make a quick comment about that. But here's what we know. When we have good quality programs for children with additional challenges are better included. When we have this fragile, broken system, those with additional challenges get pushed to the back. So we have to make a good, solid system for everyone to be able to access and pay particular attention to the children with those additional needs. But I think Elaine probably has more to say about that.
Sure, Elaine, and then Carol, I'd love to get your opinion on this as well.
I guess the one thing I'd add is that in Toronto, where we have the Every Child Belongs model, which does support children with special needs, Fortunately, in the cohorting model that's been put in place, staff who are in the role of resource consultants who really do a lot of facilitating for those children and their families, those people will still be allowed to go into the centers to provide that additional support, even, and it wouldn't impact the cohort model. So there is a recognition that children, especially as they enter back into childcare after being out of it, that those transitions are going to be very challenging for all children. I'm dealing with the trauma and the other issues that they 6 months for them is a long time. 3 months for them is a really long time. So in terms of separating from their families and returning back into another kind of experience is going to be challenging on a number of levels. And for those children that have other types of unique needs that are going to require additional support, it's good to see that support is being allowed to continue, even in the new model.
Okay, Carol, I want to get your answer on this, but the other top question right now is about childcare spaces and shared spaces in school and how they should be coordinated. So Carol, let me get to you on, again, special and complex need and that shared spaces question. I'm sorry, I'm trying to get everything in there because we don't have a lot of time left before the breakout session. Carol, over to you.
Yeah, so there is going to need to be significant additional support for so now I'm talking about school-age children with special and complex needs. You know, at the height of the pandemic, over 1.6 billion children around the world were out of school. So people have done an amazing job, but we know, unfortunately, that there are some students who are struggling more, and that includes children with special and complex needs. I mean, remote learning has been everything from distribution of physical hard copy packs all the way through to online learning. But there are significant accessibility issues in all of those options. And if the scenario is maybe full online, fully remote, or partially remote for the next year, the accessibility piece absolutely needs to be addressed. Now, I know that school boards are working on that. There really was very little in the Ontario government plan around that piece. The other piece we know is that if the preferred model currently is that 15 students and 1 adult, that's not how our classrooms operate. And we really need to think about how educational assistants and support staff can work in these scenarios. So remote learning has been teacher-led with parents. So through the piece, we have to think about how do we bring in those other staff who provide the additional support, who are usually in classes with teachers, or how that works in remote learning. Parents are being asked to truly be the first educator now, and most parents are not trained teachers. So if we're looking at another year that's going to be complex, there does need to be, I know I'm a bit of a stuck record, but there needs to be investment, resources. Everything has to look through an accessibility lens, which couldn't fully be done in the short term. And even though we're talking about back to school, as Monica has said, the summer is a period when there is going to need to also be support. We know that targeted support over the summer can make a significant difference for children and young people. So I hope that we look also at how we support those students rather than, and I don't think anybody would wait 2 months, but how do we make sure that that support is built in now? On the shared spaces, I might defer to Monica and Elaine. I mean, most of the international models are avoiding using shared spaces because of the physical distancing. So, basically every time whoever's in a room changes, the ideal is a deep cleaning in between, and that adds further complexity. But Monica and Elaine, I'm not an expert on childcare.
Yeah, Elaine, let's hear from you, but especially with those younger kids too.
Yeah, well, I mean, and I think this is really one of the challenges when we look at the proposals that the school board, that the ministry is putting forward for the school boards, and really is one of those examples of something that we need that is definitely lacking, which is much more ongoing consultation conversations to really inform these processes. If they go to a model for schools that involve children attending on alternate days, then the cohort model that they put in place for childcare is, given we provide a lot of the before and after school programs, that goes out the window, because you wouldn't be having the same group of children there for a full week, which is one of the requirements under the existing cohort models. So there's a disconnect. This isn't the only disconnect that exists between what happens in childcare and what happens in schools, but that would be a really significant one in terms of trying to find those balances between what we're required to deliver on the childcare piece of the day and what the schools are delivering. The 1 to 10 that we have now, though, that group is expected to stay together for the full week. And although we expect those numbers to increase somewhat and the cohorts to grow, which Monica was also speaking to a few minutes ago, there's still a disconnect, and the conversations and really coming together and problem solving collectively is really important, and that hasn't been the experience.
Okay, I think we can probably get ready to go to our breakout sessions now. I'm told it's very intuitive, and you'll get a little pop-up on your screen that'll send you to those breakout sessions. So I don't see one on my screen yet, but we're going to have these smaller discussions and just basically talk with the person who's facilitating and moderating your breakout session about the top things that you need right now or you want to see to open schools and childcare centers safely. So it's essentially what we've been talking about, but in smaller groups, and then we will go to each of these groups to see what solutions you have all come up with. So I'm just waiting for that pop-up to happen. Here we go. All right, so we'll see you in the breakout sessions and right after.
Thanks, everybody, and hopefully we didn't catch too many people mid-sentence there. So I want to just do a quick roundup of the one interesting or compelling idea that folks heard in their breakouts. We'll ask the moderators. For mine, it was a really great discussion about a bunch of different stuff, about a lot of practical challenges of reopening childcare centers from folks on the ground trying to do that right now. And I think the number one thing we heard was the idea that there needs to be one table with all the relevant stakeholders, and that one ministry is in charge, at least here in Ontario, Ministry of Education, yet it doesn't seem like the left hand and the right hand are working together, and that needs to be addressed. Kareem, do you want to go next?
Yeah, thanks, Sam. We had the privilege so far, Nasser was the guest in our breakout room, and we had the privilege of having two First Policy Response contributors, Annie Kidder and Kate Bezanson, in our room. And so we heard from them. I'm going to cheat and take two takeaways. One, just to build on Sam's point around having the one table. In lots of places where municipalities and school boards aren't working together, you're going to have a potentially catastrophic circumstance for parents who are being given schedules that just don't align to the extent that scheduling is going to happen in any sane way at all in September. And so Annie made the important point around the need for municipalities and school boards to work together. We also had a great discussion about the second point, a great discussion about the increasing role of care in an economic recovery, based on Kate's first policy response paper with Monica Lysick and with Monica, our guest, and Andrew Bevan and Kate Hammer, and a specific mention around the potential places where there might be some benefit in continuing to have some for-profit providers, but because they have the smaller ones have some flexibility and some ability to operate to fill the gaps, but some real concern around the prospect, at least articulated by some of the folks on the call, around big box childcare providers that are sometimes aligned with lower quality.
Great. Famita, do you want to go next?
Yep. So in our room, we had Simon and Andrew Bevan was also in our room. There was a really good discussion. We have a lot of childcare providers on this call, and they were just talking about how there's a lot of confusion right now. And the bigger problem is that the system, the way that it's set up right now, hasn't really been working in the past. And right now it's really falling apart. And so Andrew talked a little bit about this opportunity that has been brought up as a result of the desperation that a lot of parents are facing right now, and what we can do to use this moment to build out what we might be able to use in the future. So this concept of building satellite childcare centers that could be used for the long term is something that we talked about. But generally, the folks in our room were looking for an opportunity for reform in the childcare sector.
Awesome, thank you. Matthew?
Thanks. I would say our themes were very similar. I'll just, by way of trying to summarize one takeaway, it was really the need for the coordination between the education system and the childcare system. We had a lot of ECEs, educators, teachers in our room. Elaine Levy was in our room answering questions. I would say that there was a lot of interest in sharing information across providers as well. And so there were discussions about policies and systems and rules. And obviously the province and municipalities and governments are setting overarching rules, but everyone's adapting on the fly in real time. And to the extent that providers can be sharing information and talking amongst themselves about how they're trying to implement and do these best practices. I mean, I think that was a theme that came up as individuals talked about what actual local providers were planning on doing. And I just say the last piece from that is that we're 10 weeks away from schools and reopening. And the disconnect between some of the policies and some of the systems and some of the rules, the chaos that I think we're all concerned about as different departments or different organizations kind of churn out rules or guidelines or principles or schedules or all kinds of things, because that's how governments work, often in silos, often in linear ways, are going to produce a whole bunch of conflicting guidelines, rules, processes that are a source of real concern for what it's going to look like in early September.
Awesome, thank you. And Stephanie, our last one.
Thanks, Sam. So I was in Monica's room, and I'd say the main theme of the conversation was the need to have a childcare system, which we don't really have Canada-wide right now. And so that incorporated a lot of the questions that we had. One of the questions was about early childhood educators, and they've been, now childcare workers have been declared an essential service, but they haven't been declared a public service. So we spoke about the value and the need to better value the labor that childcare workers do. There was some discussion about students with special needs, students and children in the childcare system with special needs. And again, that's something that if we had, Monica was saying, if we have some overall coordination for this, we could really dedicate some funding and develop a long-term strategy. And the final question, which was an excellent, and I think one of the main things that we don't know yet, the question was, what effect is this going to have on children long term? And that's something, we're in a situation that nobody's been in for probably ever. The last time there was a pandemic of this scale, everything about the world was different. So that's something that I think we're going to all need to keep in mind, is not just how do we get through the next few months, but what's going to be the long-term effects on children of having gone through this experience.
Awesome, thank you. Well, thanks very much to our panelists, to Farah, to everyone for participating. I think this has been a really engaging, thoughtful discussion and a really rich dialogue. We're going to be posting the recording of today's town hall on our YouTube channel, as well as a written summary on our website. And also, if you go to our website, which is policyresponse.ca, just recently we've posted a roundup of 20 experts' responses to a question: what is the most important thing to consider when reopening schools and childcare? All 300 words or less from some of the best minds across the country, including some who were here today with us. And so policyresponse.ca has that and is worth checking out to dig into more of today's discussion. You can learn more about more events that we'll be doing and much more commentary to come. You can follow us on Twitter at policyresponse. And thanks very much. Happy last day of school to everyone in the school system, and stay well. Thanks for joining us today. Take care.